Goodfellow, Tarr, and I'm a clinical nurse specialist in the non-specific symptoms and gynecology straight to test pathway.
Oh wow, so how long have you been doing that for?
So I came into post in August of 2021, so just over a year now.
Okay, and what did you do before the post that you were in?
So prior to this, I worked as a gynecology pre-op assessment nurse. So I did the pre-op assessments for patients coming in for gynecological surgery, so procedures, so diagnostic to look at your uterus, to look at your fallopian tubes and your ovaries, and obviously more invasive procedures like hysterectomy, so the removal of uterus, womb and ovaries.
Is this the sort of area that you've always wanted to work in, sort of women's health and gynae, that kind of thing? Is that what you've always wanted to do since you started nursing?
So when I initially applied to work, when I was going to be qualified, I made my application, and interestingly, the three areas that I wanted to work were community, oncology and gynecology. So it's interesting that my current post mixes two of the ones that my favourite areas of expertise, which is gynecology and oncology.
And did you always want to be a nurse?
No, I didn't. Initially, when I was probably in my late teens, I wanted to be an air hostess or air stewardess. I don't know what they
different.
Yes, completely different. I wanted to travel the world at that point. Where I lived, it was quite boring, so I thought, what better way to get a job where you get to explore the world. So that was what I wanted to do when I was younger. Nursing was never ever on the radar, interestingly.
So what made you decide to jump from air hostess to nurse?
I realised when I was working in retail, so I managed to, from the age of around 16 when I started working in retail, to pay for the lovely things I had in life at that time, worked my way up to a floor manager at Debenhams on Oxford Street, and I was working there happily, living my best life as they say, and I had to help to do a bra fitting for a lady who had recently had a mastectomy, and this was completely new to me and clearly obviously completely new to her, and helping that lady, helping her to get fitted for a bra when she'd lost one of her breasts due to cancer, really opened up the fact that the job that I was currently in wasn't fulfilling me as much. And not too long after that, I quit that job and became a healthcare assistant in my local trust. Probably about 8 months later, I then actually made the application to apply to train to become a nurse. So that initial interaction in Debenhams, all those many, many years ago, is what basically led me to be where I am now.
It's funny, isn't it? It just takes one thing in life just to make you completely change course and make these big decisions in life. Mm-hmm. So what would you say a typical day looks like for you now in your current post?
So my day is quite varied. So as I said, I cover two separate pathways. So one is for gynecology. So 2-week wait referrals come through from GPs, and I triage them, so I assess as to which clinics these patients need to be referred into next. And alongside that, I also have the non-specific symptoms pathway, which is for patients where the GP has a gut feeling that the patient may have a cancer, so they may have unintentional weight loss or fatigue, or none of their symptoms point towards a specific part of their body. Mm-hmm. So they get referred to us so that we can try and work out what's going to them and either rule out cancer or find an actual diagnosis for what's going on with them. So with those two separate pathways, the referrals can be quite different. So for the gynae referrals, I usually can get up to 10, 15, 20 a day, whereas the non-specific symptoms are a little bit less, usually maybe 1, 2, 3 or 4 a week. I spend my time either processing those referrals, allocating a clinic for those patients, so whether it be gynecological patients, it may be that they need an ultrasound scan, or they may need a clinic appointment to see the consultant face to face, or they may need a procedure. So there's two clinics I can refer to. One is called colposcopy, and that looks at the cervix of a woman. And the other clinic is hysteroscopy, and that's where we use a very small camera and have a look at the inside of a woman's uterus. If a patient needed a different investigation, so for example an ultrasound scan, an MRI or a CT scan, I will also request those for those patients and get them booked in as quickly as possible.
So it sounds like it's quite a rewarding but very challenging job. So how do you kind of manage those? What sort of challenges do you see, and how do you manage those in your day-to-day?
I think with most people, time. It's about making sure that you prioritise which tasks you need to get done first of all. So usually when I come in first thing, I'll have a look on my calendar, so if I've got anything listed that needs doing. So it may be a phone call to a patient to give them some reassurance from a scan, or it might be trying to chase up some more information from a GP, and make sure I prioritise those things in my diary, so my physical diary and on my calendar. Trying to make sure that everything has a place as much as possible is really helpful, especially when I'm juggling two separate pathways. So on a Monday, I will spend the majority of my day dealing with my non-specific patients.
Mm-hmm.
Tuesday and Thursdays, I focus more on the gynecological ones, just because those are the days that they have their MDTs.
Mm-hmm.
Wednesdays and Fridays are a mixture of them both. And obviously, depending on whose needs are greater, they may kind of be 60% more to gynae, or maybe 60-70% towards non-specific. It's just about managing my time and knowing, where my priorities are.
Mm-hmm. What would you say the most rewarding part of your job is?
The interactions that I have with my patients.
Mm-hmm.
During my previous role, obviously I was spending a lot of time, so I'd spend an hour with a patient, explaining to them their procedure, getting to know them, so getting their history, whether it be social, surgical, personal, going through their bloods, going through all their investigations. Whereas with my current role, I'm doing a lot more on-the-go things, so whether it be the admin, the requesting of investigations, the chasing the GPs or other consultants. So when I get an opportunity to speak to a patient, that's the bit I really enjoy. So getting to know them, giving them information about myself, letting them know that I'm at the end of the phone if they need me, and also being able to give them good news. I think working within an oncology background, which is predominantly where I am, I think there's an assumption that because it's cancer, which is what oncology is, that it's all sad and death, but it's not. It's really positive because you can work with patients, and yes, they may have a diagnosis of cancer, but it doesn't necessarily mean the end for them. So being able to give them good news, good results in regards to investigations, especially if you've got a patient who's coming back from a previous diagnosis. And like I said, just having that time to spend with them on the phone, finding out what's going on with them, if there's anything that I can do, and supporting them.
Mm. And without giving out, any confidential information, is there a particular case study or story that stuck with you through your career journey?
Oh, through my career journey, there's loads. In my previous role, as I said, I worked in pre-op assessment for gynecology, and during that role I would go and work in the other clinics. So I'd work in the hysteroscopy clinic itself, so I'd be one of the nurses working there. And sometimes we would need to do overtime, so we'd open up the clinics on a weekend. And there was a particular lady that attended who was extremely anxious, extremely nervous, and didn't really want to be there. She knew she had to be there, but she just didn't want to be there at all. And that particular Saturday, I was the nurse doing the running, so I wasn't doing anything to do with the procedure. I was just there basically to hold the patient's hand. And I remember my usual line when we have a patient in the chair is to ask them what they would be doing if they weren't here with us right now. And she was extremely nervous. She couldn't even get her words out, but she just held onto my hand, and I said, well, okay, if you're not going to talk, I'll do it for you. So I just waffled on about random things, told her about what I'd been up to, just anything to kind of help her to relax take her mind away from what was going on. And after the procedure, unfortunately, she had what we call like a vasovagal episode, so had a bit of a fainting spell, so we had to put her into a separate room, keep her company, check on her observations, make sure that she was okay. And about 2 patients later was when we eventually sent her home. And I didn't think anything else about it. Off she went. And probably a couple of weeks later, I got an email from one of my managers to say that there was a lovely compliment in regards to me. And in the compliment, it just mentioned the fact that there was this lovely nurse. She couldn't remember my name, but despite the fact that I think she said waffled lots and lots, it made what was a horrible experience manageable and bearable, and she just wanted to say thank you. And for me, I was just doing my job. It didn't think about it, but for her it made such a difference, and to me that's really important. You want to be able to have an effect on the people that you came for, and I appreciate that. I see lots and lots of patients, and especially with the amount of referrals that I have, but if one patient is able to say that they had a positive experience, especially in the role I am now, then I'm always grateful for that, and appreciate having the positive feedback too.
So anyone that was thinking of doing nursing and perhaps going down a similar route to yourself, what sort of strengths do you think that person needs to have to go into a role like yours?
I think in particular with my role, especially because it's a dual pathway. There's 2 jobs, but just being a clinical nurse specialist or a cancer nurse specialist, it's just passion. I think it's really important that it's something that you want to do. I think if anyone was to ever decide, oh, well, this is the area I want to work for whatever reason, I think passion is really important. I'm passionate about helping others. I'm passionate about finding ways to help patients to get diagnosed for cancer, or to not get diagnosed with cancer as quickly as possible. I think as well you need to do your research, find out as much about the area that you want to work in, because I think as well when you're young, like I said, I didn't want to come anywhere near nursing when I was younger, but I found what I was interested in, and I did a bit of reading. Not so much Google back then, but went to the library, looked up, found out articles as much as possible, because I wanted to be armed with information. I didn't want to go into it not knowing, and even now if I don't know, I'll do some reading, I'll do some research, I'll use a bit of Google. Google is our friend if we use it wisely. I think as well you need to be patient. It's the position that I'm in at the moment. It wasn't a quick journey, and I did lots of other jobs before I got to this point. I'm grateful for this position because it's allowing me to work in, as I said earlier, 2 areas that I really enjoy. And I think another thing to kind of think about when you're thinking about going into nursing in particular, is that even though the initial bits may seem quite hard, I appreciate there's lots of negative press about coming into nursing or even coming into the NHS, but actually if you speak to the majority of people that work within it, we absolutely love our jobs. We're passionate about everything that we do. We wouldn't be here if we weren't. So yeah, I think the main thing for me is just being passionate really about it.
And are you working solo, or do you have a team behind you as well?
So in regards to my particular role, I am quite autonomous, but I do have a team that I work in. So because again I have 2 separate streams, so gynecology and the non-specific symptoms pathway, I have a couple of consultants, another CNS on gynae, but on non-specific symptoms it's just myself and the consultant, so we work very closely together. I think as well you have to take into account when you're working in some of these areas is it's not just you on your own. You couldn't do this without support from the bookers, so from the RAS team, so they're the ones that receive the referrals from the GP and get that information to me. There's also the MDT coordinators, so they go about making sure that we're keeping our patients to the 62-day cancer pathway, so make sure no one's lost from that point of view. They help with again, chasing up referrals, getting images from other specialities. Then obviously there's the consultants that we work with, but also the other doctors, the junior doctors, the registrars, and then you've got again the admin teams in the outpatient departments. So you've got the senior bookers, again the nursing associates, the support workers. So there's, even though sometimes it can feel like you're by yourself, in reality you've got a massive team all around you.
Do you think that makes things easier on
Definitely.
day to day?
Yeah, definitely. I think as well, if I was doing everything myself, it would be a very lonely place. But that wouldn't happen. But it's also good because I think you can never take anyone for granted, because sometimes even the people that you work with who are, say, admin, they have so much knowledge because they've been doing it for so long that they can give you some guidance. I remember that especially when I first started, because it was all new to me. So yes, I had experience in regards to gynae. I had done a lot of oncology work. They were masses of help and fountains of knowledge for me, so that I wasn't left wandering, left trying to find information out. So it's really important having that team around you and knowing who to ask and when to ask. That's important as well.
And just a final question from me. So if there's any students that are thinking about nursing or going into nursing, have you got any sort of advice or guidance, any parting words?
If you're thinking about going into nursing, do so. As I said, do a bit of your research, find out a bit more. I know it's really important to understand a lot in regards to nursing, especially if you're coming into general. But if you find there's something that you're really interested in, do some reading. If you can, spend some time with the guys here in the Health and Care Academy. I'm sure they will give you loads and loads of information and point you in the right direction. And just know that you may change your mind. There is nothing is set in stone. Like I said, I could be, flying all over the world right now for Virgin or BA, but actually I'm in the right place. You'll get there when you get there. Just know that you've got lots of support, and make sure you ask lots and lots of questions, like I did when I was learning.